talking Louisiana budget with the budget expert of them all, Jan Moller. I hope I got the last name right. I got the first name right.
You're close enough.
Okay, great. Thank you so much. Who spent 8 years as the capital reporter for the Times-Picayune, and now is the executive director of the Louisiana Budget Project. So we're going to be talking budget, some good news today, and want to hear your questions, want to see your questions, your comments, and please go ahead and share this with others. So we also have my good friend, Jim Brown. Jim, why don't you take it over? I'm going to do some things in the background on Facebook.
Good, Steve. I'd like to do so. I want to welcome Jan today and put in perspective the financial situation. Jan, as I move around...
Jan.
Well, okay, I was close. John, if I move around the state, there's a great deal of uncertainty as to what the fiscal crisis is. I think the majority of voters really don't think the state has cut back on spending enough, and they don't understand what a lot of this is. So I wish you'd start by just briefly telling us what the Louisiana Budget Project is, and then explain the Revenue Estimating Conference. What is that under the law, so that the viewers out there can understand what that does, what its purpose is, what effect does it have on the law, and what it told us today?
Great questions.
Sure. Absolutely. Well, first of all, the Louisiana Budget Project is a nonprofit research and advocacy organization. We're based in Baton Rouge, and we monitor state fiscal policy and its impact on low and moderate income families. So we are nonprofit, nonpartisan, but we do have a point of view. And that point of view is that the budget should, to the greatest extent possible, help promote the welfare of low and moderate income families. So we talk about the need to invest in things like education, healthcare, infrastructure, public safety, the things that we spend our tax dollars on. So if you're familiar with our organization, again, we are fact-based, research-based, but we do have a point of view on these things. Now, the Revenue Estimating Conference is a 4-member panel. It's made of the House Speaker, the Senate President, the Commissioner of Administration, so 2 members of the legislature, the Commissioner of Administration, who's the governor's chief budget officer, and a state economist who, from the inception of the REC at some point in the early 1990s, has been Dr. Jim Richardson from LSU. And this is the panel that gets together and decides what the official revenue forecast is. How much money Louisiana is going to take in this year, next year, and in future years from all sources of revenue: sales tax, personal income tax, corporate income tax, mineral revenues, all the various taxes that people and corporations pay, along with self-generated revenues, things like tuition and fees and other licensing revenue that comes into state government and helps state government operate every year. So they get together periodically, usually about 3 or 4 times a year, and they hear from 2 state economists. They hear from an economist from the administration and an economist from the legislature, and each of them prepares an independent forecast of what they think the state is going to take in. And then one of those forecasts gets adopted, and that adoption has to be unanimous. It has to be a 4-0 vote, or else they stick with the previous forecast. So that's how the state got away from what used to happen in the past. And I wasn't here, but I'm told that in the past, the state has to have a balanced budget, of course. Unlike the federal government, we have to balance the budget each year. But in the years past, before the Revenue Estimating Conference was created, if the state was having a bad budget year, the governor could go in and maybe increase the oil price forecast a little bit so that they could get an extra $40, $50, $100 million for whatever they needed. And so this was a way to make that system more professional, so that we have a better estimate of actually how much revenue is going to come in. Now, these forecasts are never perfect. Nobody can perfectly estimate how much all these revenue sources are going to bring in, but it's probably a lot better than what we had. And again, it's probably the most fair way to do it, because the House, the Senate, the administration, and an independent economist all have to agree on the forecast before it gets adopted.
Let me ask you this, John. If you a year is a long time. You look at the price of oil today that was announced as the highest price we've had in some time. What if 4 months from now the price of oil drops by 50% or takes a huge rise in 50%? Are there ways that you can adjust that revenue forecast to deal with spending if there's a dramatic change in the income coming to the state, either higher or lower?
Absolutely. No, that's why the Revenue Estimating Conference meets throughout the year. And so now oil prices are not as big a factor in our budget as they used to be. In 1982, for example, mineral revenues was 40% of the state budget. This year, it's a little under 4% of the state budget. So oil and gas is still very important, but as far as really driving our budget, it doesn't drive our budget in the same way that it used to. But keep in mind that the oil price forecast that is in the REC forecast is the forecast over an entire year, the average forecast. And they use the forecast, there's companies out there that do nothing all day but try to predict what the price of oil is going to be over the course of a year. So they use those forecasts as the basis of their forecast. So I believe they raised it today. This is from memory, but I think it's going up. They believe it's going to average out $59 a barrel over the course of the next fiscal year. Now, if we have a war in the Middle East or something and it goes up to 100, then I'm sure that they'll come back and say we've got more revenue than we thought we were going to have. And if we have a shock like we did in 2014, if you remember, the price of oil fell from over $100 a barrel to about $30 a barrel in the course of 8 or 9 months. That's when we had those big deficits that came up towards the end of the Jindal years. And so, yeah, these things get adjusted. And again, no economist has ever produced a perfect forecast because you're trying to predict things that you inherently don't know what's going to happen to the economy.
I want you to make that point that, it's a floating dollar amount that can change a good bit. I wanted our viewers to understand that. So where are we right now? Revenue Estimating Conference came out with some new figures that really show a drop in what the state deficit is going to be. So tell us where we are right now today.
Well, as of today, we got an extra $346 million into the forecast for the next fiscal year. That's the fiscal year that starts on July 1st. And so we're about $346 million closer to solving the fiscal cliff. But this is important. We have not solved the fiscal cliff with this. The fiscal cliff, which is different from the shortfall. And in a minute, I'll explain the difference. But the so-called fiscal cliff was at about $994 million. It's now down to about $650 million. This was something that was expected, and most of the money in this $346 million is coming from personal income taxes, and the reason is because of the Trump tax cut that passed in late December. And that is because of a quirk that really in Louisiana's Constitution called the federal income tax deduction. So we are one of only 3 states in the entire country where citizens can deduct all of their federal income taxes on their state returns. This deduction costs the state about $1 billion a year in revenue, and it also means that our tax system kind of works, it counteracts the federal tax system. So when your federal income taxes are cut, that means you have less money to deduct on your state return, so your state income tax payments actually go up. And that's where you're seeing about $302 million in extra income tax payments that we're going to pay at the state level just because the federal taxes were cut. On the other hand, when federal income taxes go up, then that means you have more money to deduct on your state return, and so your state income tax payments decrease. So this is one of the reasons why a lot of economists have talked about getting rid of the federal deduction, because it means that Louisiana's income tax is really dependent on things that we can't control, namely the federal income tax.
Well, the 346, though, that's coming in because when the Trump program lowered taxes, then is the 346 a windfall to the state? Am I still paying the same amount of money or more as a taxpayer?
As a taxpayer, if that all depends on what bracket you're in, and I don't want to make any assumptions. But if you are in the higher tax brackets where you got a large tax cut, I mean, everybody got something, but I think, you know, the more you paid in federal taxes, the bigger tax cut you got from the Trump tax cut, you know, that means that you have less money to deduct on your state return. So you're probably still going to come out ahead overall. You're definitely going to come out ahead. But if you're in an upper income taxpayer, then you got a pretty good federal tax cut, but you're going to give some of that back, not all of it, not even close to all of it, but some of that you're going to give back on your state return because you're going to pay a little bit more.
So in effect, if you're comparing federal and state, then isn't it fair then to say that the taxpayers of Louisiana are going to see a $346 million increase to the state? I know it's a washout. You're saying that the federal government does not, you know, we're not paying up to the federal government. I maybe think I'm paying more, but Louisiana benefits by $346 million from the taxpayers of Louisiana, which actually you can argue is a tax increase.
Certainly, people are going to pay more income taxes at the state level, but it's going to be less than what they're saving in the Trump tax cut. So I would not call it a wash by any means, because the state income tax rate is a lot lower than the federal income tax rate. But and again, everything depends on your individual tax situation, and so I don't want to suppose what anybody gets. But by and large, taxpayers who got a large tax cut at the federal level are going to get a much smaller tax increase at the state level. And not all of that 346 is in the personal income tax. Some of it is from other revenue sources that are a little bit higher just because the economy is improving and getting stronger. But most of it is on the personal income tax side. Interestingly, the corporate income tax forecast was left completely unchanged because the economists said they really don't know exactly how the tax cut is going to affect corporate tax payments in Louisiana, so they don't want to predict how that's going to play out. And I think that's going to be one of the mysteries and one of the most interesting things to see how it plays out over the next couple of years.
Well, then, so, go ahead, Steve. You want to chime in? Go ahead, Steve. I got a bunch of more questions. You go ahead.
No problem. Thank you so much, Jim. I really appreciate it. Great questions. So, if anybody has any questions or want to make comment, go ahead and post on Facebook. We're looking around. If you're watching, please go ahead and share. If you're watching later on after the live event, please go ahead and share. So, here's, I guess, from a political standpoint as well as you know, I guess a budgetary standpoint, I think what we're looking at is roughly 645 million, and which is a lot better than it was, close to $1 billion. And so I read elsewhere, and I put up on an article a few minutes ago on Bayou Buzz, the fact that the House is now looking at just trying to cut that 600 and again, whatever it is, 45, 47 million, the entire amount. That way we don't have a special session. I'm sure the governor would not be happy about that. I'm assuming that Louisiana Budget Project likewise would not be happy about that. First, am I right? And secondly, what are your thoughts about the possibility of being able to get those kind of cuts?
Well, we need to see how they're going to cut. I mean, $650 million is still an enormous amount of money to cut from the budget. And we know where that money has to come from because 90% of the discretionary state general fund dollars in the budget comes from healthcare, higher education, and social services. That is where it has to be cut. And so the House has had 2 years really to come up with a plan, and they kept saying, well, you know, we need to cut, we need to cut, we need to cut. We still haven't seen a plan. Last year there was supposed to be a plan. They never came up with a plan. We've been told this year that they're going to come up with a plan. We're going to see a plan next week from Cameron Henry and the House Appropriations Committee, how they plan to cut $650 million from the state budget. But my prediction is that you're going to see cuts to healthcare and higher education. Now, the irresponsible thing to do, and the thing that people have done, frankly, in the past, is they try to get out of making the tough choices, and they'll just kind of put placeholders in there in the budget. One of the things they love to do, you know, the legislature wants to be independent, but then when it comes time to actually making tough decisions on the budget, they'll put a placeholder that says, we direct the Commissioner of Administration to cut $50 million, because that way their fingerprints won't be on it. You know, the legislature has the power of the purse. And if they think that there's $650 million in cuts, they should spell it out, and they should spell it out in detail. They shouldn't pass the buck to the Department of Health. They shouldn't pass the buck and say, oh, well, we don't know. They've had the past month and a half. You know, the budget came out on January 22nd, I believe. So they've had the budget now for close to 3 months, and have had the ability to call every single state agency up there. They had the Department of Health up there for 5 or 6 hours this week in detail. So any questions that they had about the effect of these budget cuts should have been answered by now. And so let's you know, it's time for them to put their cards on the table. In our view, the more responsible route would be to replace some of the revenue that is expiring on July 1st. I mean, this is, let's not forget that this is a manufactured crisis. This is not a crisis of the economy being in recession. This is a crisis that the legislature itself created by passing temporary taxes in 2015 and 2016, putting an expiration date on there. They said at the time that this is going to be a bridge to tax reform, that we want to reform the tax system, and this is just a bridge because we know we need these revenues, and we're going to find something better to replace it. They didn't do that. There was a commission, a set of recommendations came out, and they got laughed out of the room. Nobody paid any attention, and so they're here with a problem of their own making. And if they think that the solution to this is cuts, then they should put those cuts on the table, and let's have that debate. And I suspect that I would have a different take on this than maybe some of the members of the House.
Okay, so
well, let me be the devil's advocate, if I can, with you, John, if I can. I was a state senator for 8 years. I served on the budget committee, rather I served on the Senate Finance Committee and saw these going. And if I would have been a senator today, then one option I would have would say to look, I don't have an entire staff to tell me how to break that budget down. But what you're saying, Governor, is that you're giving us a level from last year and saying this is where it's going to be. Now we got to go above this because inflation, for other factors, the Medicaid funding has increased, and therefore we got to have more money. And I would say, well, Governor, convince us, because politically back home, voters do not believe we've got a budget crisis. I can tell you, in looking poll after poll and in looking and talking to so many people across the state, there's just not a consensus that, well, we've got to raise money to solve all these problems. And so you've done this with your budget organization, the Louisiana Budget Project. Are you convinced that every dollar we're spending right now is necessary to run the state of Louisiana? Should we continue with the overtime pay that we're paying? I got a whole list of commissions that get $200,000 and $300,000 a year for travel. What on earth does the tax commission, for example, need $300,000 for travel? It's $3 or $4 million. It won't shut the hole down, but I wouldn't be convinced as an observer that the administration has really gotten into that budget and cut it back. You've got and I can go on with you with a whole list of things like this that might come up with $50 or $100 million. That's not going to solve the problem. But would you agree with me, John, that if that had been happening and the governor would be touting that, there would be a climate that would be easier for him to make his case? I'm suggesting to you he's not making his case because he's not showing any real significant cuts in areas where you could cut. Even though it wouldn't solve the problem, at least you say the guy's trying. And I just don't sense that. What's your response to that?
Well, a couple of things. I mean, I think you brought up at the start of your comments the idea of inflation. Let's be clear about the difference between the shortfall and the fiscal cliff. the way a shortfall is defined in state law, the way it's always been defined is what's the difference between the revenue that you have coming in, the revenue forecast, and the cost of doing everything next year that you're doing right now. That's not adding anything or subtracting anything from state government. That shortfall before today was estimated at $1.6 billion. It's a lot bigger number than the fiscal cliff. And that's when you account for all the inflation and some of the extra costs that you can't avoid. For example, debt service goes up every year. Retirement contributions go up every year. The cost of Medicaid, as you mentioned, goes up every year because the population is aging and healthcare inflation. The cost of the MFP, public schools, goes up every year because we have more students in public schools. So even if you don't give a single teacher a pay raise, and you don't rebuild a single school, then you still have the cost of education going up just because there are more students, and each student comes with a price tag to the state. So it was 1.6 billion this morning, and today we got another 345 million. So let's say it's 1.2. So that's the shortfall. And then the fiscal cliff is just, if we're going to bring the forecast down to spend exactly the same amount of money we have this year, we're going to eat all the inflation, we're not going to count for a single extra dollar, then that is what the fiscal cliff. So the fiscal cliff is just, if you're just going to solve the fiscal cliff, you're still making cuts in state government. Now, am I going to say that every single dollar in state government is well spent? Absolutely not. Every dollar in your company or any company, any organization in the world is going to have some level of waste and some dollar that's not efficiently allocated. And so I'm sure we can find waste, and I think that you should continue to look for that. But to say that we're not going to have a revenue conversation and we're not going to talk about these bigger issues until we found every single dollar that's wasted in state government, then you're chasing unicorns. And it's frankly not realistic. Now, you talked about, the public doesn't believe this or that we have a budget problem. The LSU survey came out this month, and it shows that the public actually, A, understands we have a fiscal crisis, B, does not want to see healthcare and education cut, especially higher education. People understand those things, and they favor a balanced approach that includes not just cuts, but looking at the revenue situation. Again, that's what the polls say. So,
did they use the word taxes? I'm just
I don't have the poll in front of me, but the LSU survey is the gold standard, and they do live telephone interviews, and this is a benchmark survey. They go out every year, and this year's survey found that people actually, they are tired of seeing healthcare and education always on the chopping block, and that is what we buy with the vast majority of our state tax dollars. I mean, we buy things for that money, and then finally, people who say we haven't looked at the cuts, that's all we did for 8 years under the previous governor. We had a streamlining commission that met for 6 months. I had to cover those meetings. 236 recommendations from the streamlining commission. Most of those were enacted. We had at least 2 commissions looking at higher education alone and how to streamline our colleges and universities. Hundreds of majors and hundreds of programs were eliminated because they were redundant. And so we made reforms in higher education to streamline that enterprise. We went out in 2013 or 14, I think, near the end of the administration. They spent $8 million on the best consultants money can buy. Alvarez and Marcel came in and looked in every corner of state government. There is if you Google Alvarez and Marcel GEMS study, it's 450 pages. You couldn't read through it, and it would take you a week to read through all the recommendations they had for streamlining and making state government more efficient and less wasteful. That's not to talk about what happened during, what individual agencies did during the Jindal years. So there's been an enormous amount of focus, time, and attention on making government more streamlined, and that process should absolutely continue. But at the same time, we have to understand that when we pay taxes to state government, and nobody likes to pay taxes, and this is a week when people are paying taxes and they don't love to do that. We are buying education, healthcare, public safety, and to a lesser extent, social services. Talk to the Department of Children and Family Services and ask them how their budget has done over the last 8 years. They'll tell you it's been cut in half, and this is one of the few areas that's actually not being cut in the governor's executive budget. And the reason is it's been cut so badly already.
Okay, I have a tweet up. Let me put it up so everybody can see it. Unfortunately, you guys can't see it, so I'll just kind of read it and paraphrase. This one is from Julia O'Donoghue, and what she's saying is that some lawmakers are looking to sports gambling, legal sports betting, fantasy sports games, to raise money without increasing taxes. And then she has a follow-up tweet. But while these bills will legalize sports betting, some fantasy sports played on your phone, etc., they actually don't say how that gambling would be regulated or taxes. Your input, please.
I haven't seen the fiscal note on any of those bills. I believe for sports gambling to be legal, it would either, I think there's a Supreme Court ruling that's due on that. And my understanding is, and this is, I'm not the expert on this at all, is that this is in anticipation of the Supreme Court ruling that sports betting should be legal, and the state, kind of trying to get ahead of that. I was a reporter in Nevada, in Las Vegas, before I was a reporter in Louisiana. And I think sports books there, I mean, they certainly made money, but I don't think it's the kind of thing that's going to save the state budget. It's certainly not going to save next year's state budget. As just a purely personal aside, having nothing to do with my budget project hat, I see no reason why you shouldn't be able to make a wager on the outcome of a sporting event, and why police resources, law enforcement resources should be devoted to hunting that down to the extent that they are. I don't know if anybody, I've never heard of a bookie getting busted. And there seems to be a lot of ways for people to gamble already. So I would see nothing wrong if they think that's a revenue source. But anybody who thinks, the two things I always get from that people want to tax and regulate is marijuana and gambling. Those are areas that people think are ripe. And again, we should probably have those conversations, but it's not going to solve next year's budget problem. I mean, there is a budget that has to be balanced by July 1st, and right now it's not close to balanced, and there are budget cuts on the table, and that's the conversation that needs to be had at the legislature.
Jim, I have a question here from Suzanne Howell Bourgeois and need to fund our most vulnerable citizens, waivers, long-term care, etc. That's from Suzanne Howell Bourgeois. Thank you so much. The governor just came out. I got an email saying that because of the federal money that we're getting for the Medicaid expansion, and he's talking about expanding, the program that we already have, that it's economic development, 19,000 jobs. Then other people say, well, wait a minute, we're actually, the money that we're spending, the additional money that we're spending goes to Medicaid expansion. So maybe you can clear some of this up at least for me.
Well, first of all, the LSU did come out with a study this week, and it was a very good study. We hear about the impacts of various economic development projects all the time, and we always used to hear about, well, these are the direct jobs that are created, and these are the indirect jobs. And what this study did from LSU, from Jim Richardson, actually the economist who sits on the Revenue Estimating Conference, applied that same logic to Medicaid expansion. And the fact is, what Medicaid expansion did, the reason this is such a good deal for the state is right now in the traditional Medicaid program, about 35–40% of the money comes from the state, and then it's matched by the federal government, which puts up the other like 60–65%. The match rate changes every year a little bit. Under Medicaid expansion, which covers working age adults under 138% of poverty. So you have to be between the ages of 18 and 64, and you have to have an income, if you're a single adult, of roughly about $15,000–16,000 a year or less. You're eligible for Medicaid expansion. The state this year is putting up 6% of the dollars, and 94% is coming from the federal government. So the state share is low to begin with, but this population is going to, we're buying coverage from them through these managed care organizations, insurance organizations, essentially, and they pay a premium tax that actually was raised in 2016. So those premium tax dollars are covering most of the state share, and the state is also saving money on the other end, because these 400, I think it's up to 486,000 people who are now covered under Medicaid expansion, most of whom were previously uninsured. They're still going to get sick. They got sick before, and when they got sick before, they went into the charity hospital system, and the state paid for that care out of what's called disproportionate share hospital dollars at 40 cents on the dollar. So somebody who was uninsured and got sick 3 years ago went into the charity hospital system, and the state covered 40% of that person's care. Today, they're covered by private insurance that the state pays 6% of, most of which is covered by a premium tax, and the federal government pays 94 cents on the dollar. That federal money that is brought into the state. Now, let's be clear. The most important thing about Medicaid expansion is that people are getting care that they need, that they weren't able to access before. But you're also bringing a lot of federal dollars into the state, and that money is paying doctors, it's paying nurses, it's paying clinics, it's paying pharmacists, it's paying orderlies, it's paying the salaries of healthcare workers. That's what the healthcare system is. And those healthcare workers are paying income tax on that. And the study that came out, I think that it's more than $50 million in income taxes. They're paying sales tax on that money. I mean, these are people who live in our communities who are working and paying taxes and being contributing members of our community who are being paid by these tax dollars, and that is economic activity. And so that's what and when they go out and they buy things, that spending supports other jobs that aren't healthcare related. And so that's when we talk about direct and indirect jobs. And it's the same formula that the government uses and economic analysts use when they talk about the impact of bringing in a steel plant or a some kind of factory. They talk about the direct jobs of people working in that factory, and then the indirect jobs of what they're spending in the community supports in terms of employment. And so that's why this study is so important. The reason we don't feel it the same way we do if somebody comes and puts a factory in your town is because this is spread out all over the state. Healthcare happens in every parish, in every town, in every city. So it's not 19,000 jobs in one location. It's 19,000 jobs spread around the state that are being supported by these Medicaid dollars. So frankly, that's been a big contributor to the economy. It's money that in many cases, I mean, we're paying federal taxes to Washington, so it's money that's coming back that we already paid, and that's generating economic activity. And I think it was one of the smartest decisions this governor has made was the decision to take advantage of that.
Okay, Jim, go ahead.
Keep it in perspective, though. I just want to be sure, we're dealing in facts because we're approaching some deadlines here. I haven't read the study, but I hope the study didn't say, okay, we've got X amount of dollars, and that X amount of dollars means this many new jobs. I got a little publishing company. And if I get a couple more books to publish more than I thought, I kind of absorb it. I'm not really going to hire any more people. I'll make a little bit more profit. but basically I'm carrying on like I am. You take all this Medicaid money, you know, it goes into doctors and it goes into the clinics, and there may be a little absorption, but this is not all. It doesn't mean we're going to go out and build new clinics and build all these new things, because we've got this absorption situation. You've got these 24-hour clinics now that are open. You've got Walmart that is starting to give you medical services. And so a lot of it can be absorbed in. So I just want to be sure that we look at the bottom line and not say this is going to mean so much more income to us, and therefore we can spend this in the state. I've never been convinced, having been in government for 28 years in Louisiana, that we really ate apart this information, at least on the state level. We've got some professionals like you talked about at LSU, but I never got a confidence that the numbers we received really were accurate numbers. And so I hope when all these studies are made that we've got some accurate information for both the Revenue Conference and the legislature, and really the governor, not the legislature, the governor to deal with. So I just make that side comment. So
no, I think that's a very good point. But I mean, we do know that Medicaid expansion is bringing in federal dollars that wouldn't otherwise come in. And we know that those federal dollars get spent in the healthcare system, and that spending generates economic activity. You know, when I go to the grocery store, you know, my wife's a teacher. She gets paid by East Baton Rouge parish taxpayers and state taxpayers. And we have a joint account. And when she goes by and buys groceries, or she goes by, or we go buy clothes, or we buy, you know, a meal in a restaurant, they don't ask whether those are taxpayer dollars or private dollars. They just know that they're getting paid for the service they provide. And that's economic activity. And when you bring in $2 billion in federal money to the state that wouldn't otherwise be here, that is economic activity that supports jobs. And that's, again, you know, the most important part is the healthcare for people that we're buying with this. But a secondary effect is the economic effect. And I think that's something we need to talk about. And that's all that study does.
Is there an increased cost or obligation, you know, in terms of budgetary obligation for the state of Louisiana? You mentioned 6% this year. I mean, how much does that translate? Is that more money that we're actually spending out of pocket?
Well, the administration says we're actually saving money. And again, it's because, A, we're paying for this with the premium tax that comes out of the MCOs. And we're also saving because we're providing less indigent care, which we were paying 40 cents on the dollar for. So in terms of state tax dollars to support the Medicaid program, the numbers are, I think it was $317 million more that we would be spending if we did not expand Medicaid. And of course, you would have a lot fewer people, a lot more people uninsured, and a lot more people who would not have the economic security of knowing that if they get sick, or if they get hit by a car on the way home, or have some unexpected serious illness, that they would be able to get the care they need without going bankrupt. And that's what uninsurance is. I mean, eventually you're going to probably get some level of care, even if you have no insurance. We're a compassionate country, a compassionate state, and we have federal law that says if you go to an emergency room, you're going to get treated, even if you can't afford to pay. The problem is you're going to get a bill that's going to follow you around and you know, ruin you financially. That's why health insurance is so important. We don't need health insurance so we can go see the doctor when we have a cough. We have health insurance in case we get cancer or we get hit by a bus, because those are the kind of bills that nobody but the absolute richest among us can pay without health insurance.
Go ahead.
So John,
yeah, go ahead.
Okay, John, the show comes to an end, and you get a cup of coffee and getting ready to go home for the day. Your phone rings, and it's Governor Edwards on the phone. He says, John, you know, I watch Steve Savladowski and Jim Brown every time they're on the air because I learn so much. It's the most important thing I do in my day. And so I heard what you said. I heard the analysis. Okay, put yourself in my place. I'll switch chairs with you, John, and you become the governor for a day. Tell me specifically, what taxes do you think palatably can be raised in this state? Where do we get the additional revenue? What are things that the public are going to buy off on to close that hole of $600 million?
Well, there's a big difference between what's politically possible at the legislature right now and what the answer is. But you know, our organization, we put out a report of recommendations. It's on our website, and you can find it at investlouisiana.org. The task force on budget and tax reform spent 200 hours hearing testimony and deliberating on this issue and came out with a report. It's very, frankly, similar to ours. The Tax Foundation was hired by the Committee of 100, and they looked at our tax structure and came out with a set of recommendations. Dr. Richardson, who we've mentioned 3 times already, he and his partners did a report for the legislature in 2015. All of these studies have some differences, but all of these studies have some basic commonalities. And what they said was, right now, we not only have a fairly low tax burden compared to other states, we have one of the lowest tax burdens in the country. Nobody likes to think about that because nobody likes to pay taxes, but we also have some taxes where we're extremely high. We have the highest sales tax in the country right now. We have, among the 40 states that have an income tax, we have the 3rd lowest personal income tax per capita, and we also pay some of the lowest property taxes. And so the common thread between all of these recommendations is we need to go up on the income tax, and we need to reduce the sales tax, and we need to broaden the base of the sales tax. Because there's a bunch of stuff that, you know, we've gone from a goods economy to a service economy in this country over the last 50 years, and we don't tax a lot of services. We tax a lot of goods. So our sales tax base is narrow, our sales tax base is convoluted, and our sales tax is too high. And meanwhile, we've got an income tax where the rates are pretty, you know, not high, they're not low, they're in the middle, but we have a lot of deductions and a lot of credits and a lot of things that bring down the overall income tax collections. Now, one of the things I said, you know, the reason we got this little windfall from the REC today is because we have this very unorthodox tax break in our Constitution, which is the federal deduction. Only 2 other states have this on their books, Alabama and Iowa. And somehow 47 other states plus the District of Columbia managed to survive and create jobs and have good economies, in many cases stronger than ours, without having this unorthodox tax break on the books. So the first thing I would do if I'm governor, and this has been proposed and rejected by the legislature, is get rid of the federal deduction. Now, there are a lot of folks who say, well, if we do that, when we don't need $1 billion in tax revenue, so we should take some of that and we should use it to bring down the overall tax rates. And that was a plan that was in the task force report. You know, if legislators wanted to do that, I would certainly support that. But getting rid of the federal tax deduction for individuals and corporations and using some of that money to bring down the sales tax rate would be the basic place where I would start. Because I think you can, you don't have to raise the income tax rates at all. You can get rid of this one deduction, and you can make our revenue system a lot more adequate. And you can hope for, and the other thing we need to do is get away from temporary taxes. Jim, you were probably in the legislature during the era, this was before I got to Louisiana, when they had to replace the so-called temporary taxes that were passed during the oil bust. And temporary meant 17 years, you know, and every other year you had to go in and you had to have a big debate about are we going to renew this temporary sales tax, or are we going to turn off the ventilators and throw widows and orphans into the streets? That's no way to run a government. And as you know, Jim, a legislator named Vic Stelly was the one who finally made that train stop and did some tax reform that wasn't popular with everybody, but was necessary. And we actually had a pretty stable and predictable budget for a few years until Hurricane Katrina, and everything got thrown out of whack again, and we got kind of off the tracks. So, but in general, you know, I think we need to, get away from temporary taxes, find something permanent so that we can stabilize the budget and stop moving from crisis to crisis. And we need to get rid of some of the unorthodox tax breaks that we have that reduce what we collect through our income tax.
Okay, Jim, go ahead. One last question for you, and I have a question, and then we'll say goodbye. Go ahead.
Well, continue with your projections as you're being the predictor. What do you think is where are we going to end up? Do you think we're going to put Band-Aids on and limp along and have another special session, which a number of people are saying is going to happen? I see the governor says he wants to shut down this session very early. Or do you think something will come out of it? Are we going to linger and carry on this debate and try to squeeze through? Or do you think something significant will happen here in the next, say, 30 to 40 days, John?
That's a great question. I hate to make predictions because I'm usually wrong, but I predict the picture will get a lot clearer next week when we see what the House Appropriations Committee has in mind. We have not seen how they propose to balance the budget with $650 million in cuts, and my sincere hope is that they take this task very seriously and that they are specific in how they plan to cut the budget, because the easy way out would be to kind of put these little placeholder items in there and sort of punt this to the administration. If you believe the budget should be cut, I can respect that position, but I think you need to be specific. And then we can have a debate on is this a level of cuts that you're willing to live with politically? Can you get 53 votes in the House and 20 in the Senate? And will the governor veto? My belief, if I could, I have no inside knowledge on this, but when the governor presented the budget to the legislature, of course, when the shortfall was a little bit bigger, he all but said that if you send me my own budget, I'm going to veto it, because the cuts that I've had to propose, because I have to propose a balanced budget, are unacceptable cuts. And so if I believe, and I cannot speak for the governor, and I'm not pretending to, but if the legislature sends him a budget that contains the kind of cuts to higher education and healthcare that he finds unacceptable, that he would veto it. And then we'll see where it goes from there. I hope it doesn't get to that point. I hope that cooler heads can prevail, and that Louisiana has I think we have a lot of problems in this state, but we also have a tradition of legislators and governors putting their partisan differences aside and getting together in a collegial fashion and hammering these things out. And we've gotten away from that a little bit, I think, but I hope that they can get back to that because I don't think anybody wants to be in special session at the end of June wondering whether, LSU is going to have proper funding and whether, the hospital in Lafayette or New Orleans is going to be able to keep its doors open.
So yesterday, Jim Brown and Christopher Tidmore and I had a conversation on Facebook Live. Christopher and I'm going to just kind of paraphrase what he said. Basically, he was saying that if we don't, within the next, say, 2 weeks, let the healthcare industry know what money we're going to be spending for healthcare, that I guess that it's going to hit the fan. Hospitals will close, etc. Have you heard anything about that? Having a time fuse, letting the hospitals know, okay, we will do this by so-and-so date?
There are letters that have gone out, I believe, from University Medical Center in New Orleans and Lafayette General, which are the partnership hospitals that took the place of the charity hospitals. They're the ones that are looking at the most significant cuts under the budget as it exists right now. And they have said that if you fund us at the levels that are in the budget, we're going to walk away from our state contracts. So that is one of the big problems that the governor certainly, that the legislature needs to solve, because not only are we talking about the care that's provided in that hospital, but we're talking about medical education, particularly in New Orleans. We spent $1.5 billion building a state-of-the-art teaching hospital down there. That is where the next generation of doctors and nurses and allied health professionals are coming from the medical school in New Orleans, in Shreveport, and that's where they train. And if you take that funding away, then you are not just hurting patient care, but much more importantly, you are causing the next generation of medical professionals to leave the state for some place where they don't have to worry year by year whether their training ground is going to be funded. So I think that is very serious. The other very serious thing, and why I wish we weren't at this point right now, is TOPS. You know, right now, students across this state are making decisions about where they're going to go to school next year. And it's really those students at the top of the achievement list who are trying to decide. They don't know if they're going to have a scholarship in Louisiana next year, but they might have a scholarship from another school. So that's why these decisions need to be made soon, because I think it's students, it's professors, it's people affiliated with the universities who have gotten, they got a little reprieve. You know, we cut higher ed very severely from 2009 till 2015. In the last couple of years, the budget's been kind of stable, and there hasn't been the same sense of crisis. But that sense of crisis, if you heard the college leaders talking, it's back, and that's affecting students. It's affecting prospective students and faculty members who are trying to decide, am I going to continue my career in Louisiana, or am I going to look for a job in a place that has a more stable budget?
Any last comments, Jim?
No, I think that John has given us good food for thought, and I'll be anxious to see what happens next week. So maybe we can talk about it again next week, Steve, once we get a little more information to see, are we going to be just stuck in the mud and live week to week and get into another special session, or will we see light at the end of the tunnel? So I look forward to have that discussion next week with you.
Jan, really great information. I mean, truly. So what I'm going to do with this is we're going to take the content, we'll set it up into segments with transcript and video, and put it up on Bayou Buzz and put it on social media, etc. So, my God, it's kind of at the end of the program. I really appreciate you taking your time being with us. Those people watching, please go ahead and share so that your friends, your Facebook, Twitter contacts get a chance to watch this. And we, again, on behalf of Jim and certainly myself and Bayou Buzz, thank you so much. If you could just hold on, I'm going to push a button and say goodbye to everybody. But thank you, Jan.
Well, thank you very much for having me on. I really appreciate it.